Welcome back. You're watching Invest Africa, and still with me in studio unpacking Africa's healthcare sector is Sven. He's KPMG's head of Healthcare Africa, and Stavros Nicolaou, senior executive of strategic trade at Aspen. Joining us from our Nairobi bureau is Shakir, Merali, a partner at the Abraaj group. Now, we were talking about doing business at a lower cost and catering to the market at a lower cost. Just how achievable is it in the African context, Stavros?
Alicia, look, I think the first thing is one needs to be clear as to how one defines affordability. And because in many instances, even if you reduce drug prices down to 5 cents, if you're only earning $1 a day, that's 5% of what you'd be consuming would be on healthcare. So I think what we have proven, certainly as Aspen, is as a homegrown manufacturer on the continent, we're able to compete with the Asians, we're able to compete with the Europeans. I say this because when it's come to tendering for products, for example, in the South African market, then we've been able to often capture the lion's share of many tenders. So I think our competitiveness in South Africa, were you to export out of South Africa into the continent, I think there's a track record there. But the real challenge is, for me, how do you tap into, as Sven said, the emerging middle class? Because as income levels are rising, as you start depending less and less on donor funding on the continent, then this middle class becomes an interesting target audience for you. And that target audience does not necessarily only look at price in its decision making. It looks at both quality, accessibility, after-sales service, and then price. It's a combination of things. So I think I'd like to suggest that the dynamics are changing slightly on the continent. And the companies that I believe will succeed and will do well on the continent are those that have the ability to aggregate those volumes, understanding that Africa is not a homogeneous market, but aggregating those volumes, getting the scale of economy, and providing a quality, affordable pharmaceutical product to the continent.
And perhaps drawing from lessons from other emerging markets as well. So, Shakir, you've just gotten back from India, and you've been talking to players on that end within the healthcare space about their low-cost models that are currently in place, how exactly they're implementing it. What kind of lessons have you come back home with?
For us, our mandate with our fund is actually to invest in businesses that, while sustainable and profitable, are actually serving what we define to be the base of the pyramid. And that, for our purposes, is people earning $3,000 purchasing power parity per annum. That's what makes our investors happy, which includes the likes of the IFC and the Bill and Melinda Gates Foundation. It was the genesis of the particular fund for healthcare that we're managing in Africa. Now, what this means is that we need to ensure that the businesses we invest in can actually successfully target that market. As you pointed out, I was actually in India meeting up with some of the more successful companies that have been able to achieve this. Now, there are two things. One is India has some systemic benefits. The number of people that actually train to be doctors, the volumes in specific markets and so on, that cannot easily be replicated in Africa. But the other thing that actually can be replicated is their focus on process and ensuring that when specific procedures are carried out, the utilization of scarce doctor resources is on those areas that are of the highest value, and that with the right sort of training, you can get the equivalent of nurses and clinical officers to do other parts of the process, and therefore allow many more processes or procedures to take place in a given time frame, and better effectively utilize a doctor's time. So that's one specific example. There are other examples around securing economies of scale, as well as just getting a mindset of actually driving down margins, but leveraging off high volumes. And so these are all models that we're going to be implementing in the 16 or so investments that we've got in healthcare across the continent.
Sven, that with a focus on catering to the base of the pyramid, it's something that one would assume make a lot of the African governments happy as well, because a lot of this depends on those independent policy decisions being brought online by independent governments. We had Stavros highlighting that we cannot look at Africa as this homogeneous entity.
Yeah, no, quite right. So absolutely true that innovation will set us free around this, and so we've had a couple of examples of what innovation looks like. In the business, we refer to what we just heard as skill mix. So how do you think about changing the skill mix? That's a regulatory question. Each country will answer that differently. You obviously, in scarce resources, want every professional to operate at the top of their license. And in some cases, and so what we help governments do and we help businesses implement, is think about how they rearrange their skill mix so that they can focus on the patients and also increase throughput. Because the truth is, we will never as a continent be able to afford the nurse numbers or the patient or the doctor numbers of most other countries. First of all, we could never find the people, and secondly, we could never afford them even if we could find them. So it's not possible. So we are going to have to structure our health services much differently. And what the continent is crying out for is new investment around innovation to really begin to think through two things. The first is, how is it that we drive access for millions of citizens who have now come into the middle class, are demanding, understand what good looks like, and want that level of service. And of course, how do we bring different partners around that, both medical technology businesses, pharmaceutical businesses, business process businesses, to really bring the very best of service delivery to patients.
And what that does do, Stavros, is put into the spotlight the role of PPPs specifically. So take us through how you're approaching that business, doing business with government, because there are also very big trust issues that we have to bring into the fray here.
I think that part of that gap has been bridged. That not completely. I can't say that the parties are completely in sync when it comes to the trust issue, but what has to an extent accelerated that alignment of trust has been the nature of the epidemiologies on the continent. So I think you've had these massive pandemics of infectious diseases which have had to, by necessity, bring the public and the private sector together. And often there's an interlocutor somewhere in between, whether it's the Clinton Foundation or the Global Fund or any other such agency. You are starting to bridge those gaps. And the rollout of antiretrovirals on the continent is a very good example of how governments and private sector got together and said, look, we've got challenges around patents, these drugs are unaffordable, how do we work together and cut through all of that and deliver affordable antiretrovirals on the continent? And I think, although many imperfections, I think a lot of successes were achieved in that and have paved the way for future successes.
Is the regulatory environment supportive of doing business?
Well, a very broad question, because it depends on whether you mean at an industrial level or at a health level. But certainly at an industrial level, the answer would be a resounding no. I think governments on the continent, in fact our own government in South Africa here, I think needs to be more sensitive to customizing the type of industrial packages that are placed before the private sector. I think at this point in time they're sort of a one-size-fits-all. They've got to be customized, and I can say this equally across the continent. Even though many parts of the continent have less resources than we have in this country, I think you've got to start picking your sectors and start picking your industries and your companies and saying, well, how do I tailor something as a government that's going to make a success of this company and create the jobs and that whole multiplier effect that come with
Just to conclude, Shakir, let's get some comment from you, your outlook for this industry on the African continent moving forward.
Healthcare is definitely set to grow. If you look at the statistics in each of the individual countries, the growth of healthcare spend projected over the next 5 years is going to be, growing at CAGRs at 10% plus. And historically in some of these markets, they've been growing at compounded rates of 14–15% plus. As more people move into the mid-market of the BOP, as they become middle class, then they want to have better services, and so the first place that they're going to look for is education and healthcare, and so this area, as I say, is set to boom. So from our perspective, it's an area, and it's not just limited to Africa, mind you. It's across all emerging markets, and we're seeing this as an area where we are going to continue to be doing a lot more in terms of investment and growth.